That's a tough one. How does one advocate themselves, but you don't want to offend the authority figure in your life? Well, the simple answer is you got to be an advocate. If your questions are not being answered, if you're not understanding them, I know the docs are overscheduled, busy, and they want to provide good care, but they got the pressure to move on. Same with the therapists and the nurses and the nutritionists. Everyone's very busy. But you are the most important person in that room at that moment. So you need to advocate for yourself in a polite and respectful manner and say, hey, I hear you. I'm just not getting it. Please help. Lead with kindness. Most people will take the time to do it. There's always some people out there that give our field a bad name. But most people, if you're taking care of patients with neuromuscular, you realize you're going to be working with very complicated, very labor-intensive illness. And so you've got to really want to go that extra distance. But the really answer at the end of the day is you got to be a self-advocate. You have to stand up for yourself. We're all part of the team. We're all stressed. Your patients are stressed because they're not doing as well as they want. Doctors are stressed because we have to see a lot of patients. Hey, welcome to the United States healthcare system. We're all stressed, but we're all trying to do our best. Advocate for yourself. Stand up for yourself. Tell them what your needs are, what your concerns are, and say, look, if you can't get it all done, they go, look, I know you're busy, and I've taken up a lot of time. Can we continue this conversation sometime after class? I'm happy to call back at a mutually beneficial time. There's more than one way to get your questions answered. Work with your team. Again, the vast majority of people taking care of neuromuscular weak patients, they know what they got into. They love it. They want to help families out, and they'll take that time.